Good morning. I am Julie Renner, and I want to welcome you all to this webinar to talk about all things initial certification for program directors. I am going to hand it over in just a moment to our president, Dr. Diane Gorgas.
Thanks, Julie, and welcome everybody. Thanks for taking some time to spend with us today to talk about the initial certification process. We're going to jump right into it, but today's conversation is really going to focus on what ABEM is all about, what your role in ABEM is, the steps to certification. I know many of you are here specifically to hear about the certifying exam and the resources that we have. But we're also going to take some time for a little bit of a walk through the new My ABEM portal, and then have an opportunity to answer your questions at the end. So I want to be sure we save time for questions, so let's jump right in. Let's first go over ABEM's role in our specialty. We are the organization that certifies emergency physicians who meet the educational, professional standing, and examination standards. And standards are criterion referenced, which means that they are referenced to current practicing emergency physicians. The ABEM Board of Directors are experts in this field, and we are all clinically active emergency physicians. As a matter of fact, I just worked yesterday, a Wednesday without the residents. So we get to flex our clinical muscles as well. Hopefully we understand what practicing emergency physicians go through. We have a diverse set of skills on the board of directors, a diverse set of backgrounds. We have community medicine physicians and academicians and even public members. And our mission is really to ensure the highest standards in emergency medicine. It's our certification is sought and earned by emergency physicians on a voluntary basis. But that being said, we capture well over 95% of the 90 to 95% of current emergency physicians in their certification pathway of choice. Our purpose is really to improve the quality of emergency medicine care, to establish and maintain the high standards of excellence in emergency medicine, but also to enhance emergency medicine education and the education in all the related subspecialties as well. We evaluate physicians and promote professional development through initial and continuous certification in EM and its subspecialties. And we certify physicians who've demonstrated special knowledge and skills in emergency medicine. We have worked hard on enhancing the value of certification for ABEM diplomats, and this is because our important key mission is to serve the public and the medical profession. We hold the interests of patients and their families in the highest standings, particularly with regard to the provisions of the safest and highest quality emergency care. Visit the ABEM website, please, to learn more about the board, our mission, our initiatives, and our certifications. We recognize the important role you play in educating and preparing residents for a successful career in emergency medicine. Many of the board of directors are former program directors, myself included. ABEM is eternally grateful for your dedication to training and supporting residents. ABEM often says it is not just the examination, it is the training. You play an important role in the specialty of emergency medicine. And what we're really here today is to ensure that you have all the information needed to prepare and guide residents to a successful ABEM certification process. Next slide. As you have likely heard, the steps to certification will be changing in 2026. The oral exam, which is near and dear to many of us, while proven relevant, it's going to be going away in 2025. And the reason for that is that it was relevant and it was valid, but it was not broad enough in the skills that it assessed. So in 2026, the final step for certification will be the new certifying exam. And once a candidate passes that new certifying exam, they are ABEM certified and become a diplomat. The application process is already underway. ABEM emails application information to residents when the application is open, and that has been open. And this is done online through the new ABEM portal that Julie's going to be talking about a little bit later in this time together. We really want you to encourage your residents to not delay. They should apply as soon as they receive notice from ABEM to avoid late fees. Now, those late fees don't go into effect until much later in the summer or even early fall, but it is really best not to delay. These things can get forgotten, and it's also best not to delay certification. Residents can apply the year that they are graduating. They will take the qualifying exam that fall and then the certifying exam the following year. All of our statistics show that those residents that decide or / may be encouraged to delay certification by a year or more do worse with their chances of passing the qualifying exam and the certifying exam. So please encourage your residents. They may have the best intention to read Rosen's or Tintinelli from cover to cover to better prepare for the exam, but the peak performance that they will get is that first year that they graduate. What's new in this process is that submitting the application and registering for the qualifying exam can all happen in one step in the new MyABEM system. Then the resident can schedule a qualifying exam appointment with Pearson VUE. And as many of you are aware, Pearson VUE testing centers, it's a national testing center. There's over 250 of them in all 50 states, and that's where the qualifying exam or the written exam is administered. It will be a requirement for all candidates that the program directors complete a verification of training. So after your resident's graduation and successful completion of training, you are going to need to complete the resident verification of training form on the ABEM portal. And it will be the updated attestation form that I'll talk about in just a minute. Residents become board eligible once you complete the verification form. And it expires 5 years later on December 31st of that final year. So that board eligibility period lasts for 5 years after you sign the certification. Again, it's another great reminder to please encourage your residents to apply and to take the initial certification examinations as soon as they are able after graduation. Now, if you have a resident that's a little bit off cycle, as long as they are graduating on November 1st of 2025 or earlier, they should apply for this cycle. We can get them through the system and assure them a seat for the qualifying exam as long as they are graduating on or before November 1st. Next slide. Again, many of you are aware that there is a brand new program director attestation form out. The attestation is really designed to have more detail on the competencies. For example, can the candidate or the residency graduate manage a difficult airway in all ages? We are continuing to use this PD attestation form formatively during 2025, which means that it is there as a signal for all y'all to realize that in 2026, the attestation will count towards board eligibility and the ability to take the qualifying exam. The copy of the attestation form is available on ABEM's website, as is all of this material that I'm going to be discussing today. Next slide. The qualifying exam, the registration opens for it May 27th through October 9th. It's a 1-week administration window. And that 1 week is November 3rd through the 12th of 2025. And it's given, as I mentioned, at Pearson VUE testing centers. It's composed of 305 multiple choice questions, and it is criterion referenced, which means that it is referenced based on the critical knowledge and skills that practicing emergency physicians can demonstrate. ABEM is committed to getting candidates their scores back on the qualifying exam within 90 days. And we have generally fallen well within that time window. Typically, it's been less than 30 days. But just to make sure that if we need to do a standard setting on this, that we have the time to do that, we commit to all the candidates to have their scores back within 90 days. Please also remember that the in-training exam score can really help you as a program director to determine the projected qualifying exam score. ABEM gives the residents a percentage of expected pass rate based on the in-training exam. And those are highly predictive of how a resident is going to do on the qualifying exam. So take those in-training exam scores very seriously. Please don't wait until the terminal year of residency to realize that a resident is behind the mark of where you would expect them to be at graduation before you start intervening and really giving those residents some extra resources to increase their in-training exam score. Next slide. Again, all of you are likely aware that the pass rate for first-time test takers of the qualifying exam is now 82%. And for all test takers, this includes repeat test takers, the pass rate is 80%. And this is definitely lower than in 2023. This is a trend that we've been seeing since 2019, which is actually a bit before COVID. But we are now at the point where we are taking a serious long look at this. During the over 2 years of stakeholder feedback during the Becoming Certified initiative, ABEM really heard from the specialty that maintaining high standards was of paramount importance. And it's important to know that the qualifying examination is not more difficult than it has been in previous years. ABEM is maintaining the high standards by maintaining the current standard for the qualifying exam. A standard setting was done in 2019 for the qualifying exam, and since then, all subsequent exams have been psychometrically equated to this standard, which assures that the exam difficulty has remained unchanged since 2019. But because of the magnitude of this year's decline, ABEM verified that this is a real decline in performance and not a function of a more difficult exam. As I mentioned, this is a 6-year trend in declining performance. We're committed to working with the emergency medicine community to identify any factors associated with the decline in exam performance. And we really seek to answer these questions and provide support on the next step for all physicians in the certification project. Next slide. But the new information that I'm here to share with you really focuses on the certifying exam. The certifying exam has been a multi-step process. We went through a 2-year Becoming Certified initiative that looked at input from over 4,000 voices. We collected input via survey, focus groups, interviews. We had a summit. We sought input from many different voices within the emergency medicine community, including program directors, residents, the public, healthcare administration leaders, employers of emergency physicians. And the findings were really that we needed to innovate in our assessment. And that included the use of simulation. We needed to assess more than just problem solving. We needed to assess communication and interpersonal skills. And in the future, we also need to think about assessing teamwork and consider the future of a medicine, including artificial intelligence and what impact that's going to have in the practice of emergency medicine, but also the definition of competency of an emergency physician. So we are now in the terminal stages of developing and rolling out the new certifying exam. And it is going to be assessing additional competencies, many focused on communication and interpersonal skills, but also some focused directly on procedural competency, invasive procedural skills, and ultrasound skills. We know that as emergency medicine practice has changed, the certification has to change to meet those new demands. It's really more important than ever that we have a rigorous, valid, fair, and reliable certification process. It helps differentiate emergency medicine trained physicians from other physicians who may be working in the emergency department. And equally as importantly, it differentiates between physicians and non-physician providers. The new certifying exam format is a 1/2 day in-person session. There will be 2 types of cases: clinical care cases and communication and procedural cases. We can't really assess the quality of care, decision-making, and communication on Zoom. So this really has to be done in person in a new way. And this next slide shows us the different types and the different formats of the certifying exam cases. We divide them philosophically kind of into 2 big buckets, and they will be divided on an exam day into 2 sections or 2 portions. The first section is the clinical care cases. These are 15-minute cases, and each candidate will have 4 of these cases in an exam session. There will be 2 examiners in each room for these, and the content areas for them are clinical decision-making. So think about the structured interview, but with more meat on its bones. Generalize ways of thinking and really getting to the heart of what a candidate is using as their toolkit to make decisions that impact clinical care. The second type of clinical care case is the prioritization case. The 2 types that will be rolling out on this in the year 2026 are a tracking board case. So a number of patients presenting with undifferentiated diagnoses, they come in with chief complaints, a set of vital signs is obtained on those patients, and the candidate is to sort through those handful of patients and decide what critical information they may need on those patients, and also what critical interventions may need to take place in order to stabilize those patients. The second type of prioritization case is the triage of multiple patients arriving without warning, or the mass casualty incident case. And what is the thought pattern and what is the rubric behind the candidate being able to sort through multiple patients arriving at one time? And what thought process do they use? What philosophies do they take? How do they adjust to changing information in that? Those comprise the clinical care cases. The second portion of the exam are the communication and procedural cases. These are all 10-minute cases. There are 6 cases per exam session. So along with the clinical care cases, this makes up 10 cases for a completed examination. There is 1 case on procedures and 1 case on ultrasound for each and every candidate. And there will be an examiner in the room during those cases. The other 4 cases of the 6 cases that make up communication and procedure cases will have standardized patient actors in the room. And the content areas that we're really looking to assess in these are reassessment or troubleshooting. What happens when the candidate is presented with new data? What happens when there's an unexpected turn of events during the treatment of a patient? How does the candidate adapt to that? Part of what we're testing is the ability to let go of an anchor of a presumptive diagnosis and move in a different way of thinking. Every candidate will also have 2 patient-centered communication cases. And these are truly looking at how a candidate takes in a history and a physical exam on a patient, interprets laboratory data and diagnostic studies, but also comes to a disposition that is patient-centered and the way that they communicate that to the patient. And then half of the candidates will have a assessment station based on a difficult conversation. And when I say difficult conversations, this is really breaking bad news, a critical skill that all of us needed to master in emergency medicine, but that it's really our job as the Board of Emergency Medicine to be able to assess. The other half of candidates will have a case that is based on managing conflict. And that can be conflict with anybody. It can be conflict with another professional. It can be conflict with a patient family. It can be conflict with the patient, his or herself. The group will be split, and half will receive the difficult conversations case and half will be the managing conflict case. And we can tell you rest assuredly that the degree of difficulty of both of those will be equated across the exam so that one exam type is not more difficult than the other. Next slide. ABEM is really committed to having a fair exam and eliminating bias in any testing setting. All of the staff, directors, item writers, examiners will undergo bias training, and the cases undergo a separate bias review. ABEM is accredited by the National Commission for Certifying Agencies, which really upholds the highest standards for fairness, reliability, and validity. Some of the ways that we are, walking the walk with this as opposed to just talking the talk, is that our professional patient actors are experienced. They represent real patients that residents and subsequently candidates will see in the emergency department. And we think that this will really increase the reliability of the exam. The examiners are also evaluated for each and every administration in their administration of the test itself, but also their scoring accuracy. The scoring and the equating process adjust for the variance in scoring stringency. We will also have a subset of cases, especially those with the potential for bias, that will be scored by multiple different individuals. And we'll be looking at kappa values and looking at inter-rater reliability to make sure that we eliminate any bias from the testing scenarios. Next slide. ABEM was really looking at flexible scheduling options for exam candidates. Rather than just 3 times a year, we now will have 9 administrations throughout the year. And this is going to allow candidates to really have a lot more flexibility and personal input into when they find a testing window is going to work best for them. Candidates are going to be able to request exam administrations and share conflicts for those that don't work. Now, if a candidate wants to only be examined on one day and a particular day of the week of all of these 9 weeks, we're not going to be able to do that. But we will certainly be able to assign candidates to a half a day of testing during one or multiple exam administration windows throughout the year. And I truly hopeful that this decreases the amount of angst of our candidates moving forward, and the amount of flexibility that we can give them to adjust schedules to their personal and other commitments. Next slide. New resources are now available on the ABEM website. So please check out the new certifying exam resources that are available. The certifying exam example cases that have been up on the website since about February, March. There are now debrief videos on all of those that talk about the way that the candidate performed and talk about some of the markers that are used for developing a scoring rubric for those individuals. There is also new information on the website that has a procedure list and a list of ultrasound images and ultrasound examinations that are expected as fair game to be tested. This will be helpful as you're creating your own plans for preparing residents for mock administrations and for training. All of the resources can be accessed through this QR code, but they can also be accessed by just going to the website, www.abem.org. There is sample case videos, there are debrief videos, there are scoring guidelines that are encompassed within the PDF of every case description. There are case references, there are case summaries, there is a procedure list, and there is an ultrasound list. I want to emphasize that I think ABEM has been open to suggestions from the Council of Residency Directors and the training community of emergency physicians at large to really make this as transparent a process as possible. So we've really listened to you. We listened to you at CORD in March. We've made changes based on the website since then. So please utilize those resources that are out there. They will largely answer most of your questions and really hopefully take away some of the anxiety that candidates are feeling and that you may be feeling as a program director. So one sample case video is available for each of the 8 case types, including a PDF of the case materials. Each case type is specifically designed to assess different competencies that are important to the specialty. And these samples were created to demonstrate the flow and the mechanics of a case, not to explicitly anchor to the case content. The sample cases that are posted on the website represent a typical case format using an average passing test taker. And the videos also have accompanying case materials available. The scoring information is also helpful to consider when reviewing the videos, and there is a separate link for the scoring information. Some common questions that we get and questions that you have been able to send us prior to this webinar. How is it different than the oral exam? I hopefully have answered this. It's an assessment that is even more relevant to the practice of emergency medicine. It assesses different competencies, specifically additional competencies than the current oral exam format. And it's really going to be relevant to the practice and adaptable to changes in medicine. What about a testing center on the West Coast? We would love to have found a testing center on the West Coast. The center in Raleigh, where this examination is going to be held, is really a testing center and not a simulation center. We will have between 3,500 and 4,000 candidates to have to assess during that first year that the certifying exam goes live, which is 2026, coming up 6 months. We needed a center that had the capacity to be able to do that. There were no such centers on the West Coast. So we're going to provide scheduling accommodations to the candidates from the West Coast. And we will also be keeping an eye out for if any testing centers emerge in the years ahead that we could possibly use as an option for the West Coast. ABEM is happy to consider those. How can you as a program director help prepare your residents for the new format? It's feedback, feedback, feedback. So use the resources on our website. Watch for additional information. Request a speaker. We'll be talking about how you can request a speaker and how many programs have requested a speaker. And I think having a speaker either come to your program or deliver a virtual presentation to your residents on what the certifying exam is really helps take the mystery out of this entire process and makes everybody feel a lot better. So if you haven't had an opportunity to do that yet, please consider it. please look at the resources that are on the website as well, not just the videos, but the citations and the reference documents that have been used to create the cases. There is a lot of anxiety in the residents about the ultrasound and the procedure cases. I am trying every time I speak to a resident to say, don't ignore the communication cases. There are best practices for managing conflict. There are best practices for breaking bad news. It would really behoove your residents if you had a great understanding of what those best practices were and were modeling that for them and testing that ahead of the high stakes exam. What will candidates wear to the exam? ABEM has long said that we don't judge candidates on their fashion choices. But we also understand that this is a different exam than just sitting in front of somebody across from a table. So if candidates wish to wear scrubs to the exam, we would encourage them to do so. There will be an opportunity to get ultrasound gel goop on their best clothes. So scrubs may be the fashion of choice. All that we ask is whatever the resident is wearing, it should not be branded with any institution or site where they're working. So if it comes in, like in my case, with a big Ohio State logo on one side, we prefer that the candidate did not wear that to the exam. If they end up wearing it to the exam, we're going to ask them to either remove that jacket, or we're going to put a big piece of masking tape over it, because we don't want that to contribute to any bias that the examiners may have. ABEM examiners really are trained to eliminate any bias in scoring, including that based on attire. But it would be really helpful if large logos, graphic t-shirts or sweatshirts, or your institution's logos, if people could come without those already. Next slide. And this is your opportunity to request a speaker. The QR code is right there for it. ABEM has been able to reach over 120 residency programs to share the latest information on the certifying exam. That's 40% of emergency medicine residency programs. Please do not disadvantage your program by not having an ABEM speaker come. It's our opportunity for you to share not only with the residents in your program, but all of your colleagues who may be interested. So if you haven't already signed up with an ABEM speaker, please go ahead and do so. Again, we'd be happy to come talk to you. Next slide. So what's next? The certifying exam is going to launch in 2026. We have 2 more virtual oral exams to complete. We're going to be developing orientation videos that will be a real a video walkthrough of the on-site logistics, a walkthrough of the AIM center where the exam is going to be taking place. And we're going to be having ongoing updates through ABEM. We really do have a shared interest in this. We want early career physicians to be successful. We want early career physicians to achieve certification, just like you do. And we want early career physicians to have that essential skill set to be able to continue engendering public, patient, and family trust in the field of emergency medicine. And the long and short of it is, we want ABEM certification to have value. We want it to be valued by hospital systems, by insurers, and by the public. And we are confident that the new certifying exam is going to increase the value of ABEM certification. And we're here to support you. We're here to support you. We're here to support your residents. We're an open conduit. If you have any questions that this webinar does not answer for you, if you have suggestions, we are certainly happy to take those into consideration. Please just drop us a line. And we are here to also give you ongoing support. Once certified, we really strive to promote the value and expertise of you as a specialist. A COBSEP is a initiative within ABEM that gives physicians the power to forego merit-based medicine, including like PALS and ACLS. We have a plethora of resources to promote your certification. Go to the website and check those out. Regarding continuous certification, we help you stay current and stay certified. And there are lots of volunteer opportunities with ABEM as well. If you or your program do not have representation with an ABEM volunteer, please reach out to ABEM. Please reach out to me. Our goal ultimately is to have an ABEM volunteer at each and every residency training program across the US. That helps us stay in touch with residents and stay in touch with academic faculty and their concerns about certification. And lastly, we do want to listen to your feedback. We have listened to your feedback. It is from the talk that I gave at CORD in March that we have updated the website and include more resources on the website. And we want to continue listening to your feedback. So keep in mind, you can always find these resources at www.abem.org. I'm going to turn it over to Sarah and Julie at this time to go through the new website walkthrough. And thank you for your time. I'll be here to answer your questions at the end of this presentation.
Thank you, Dr. Gorgas. So I'm going to go through the ABEM public website and some resources for you, as well as talk you through some key features of the new My ABEM portal. So the screen that you see right now, where the red circle is, that Get Certified section of the ABEM public website is where your residents can find out general information, not necessarily specific to them. Find exam dates, any of the information that Diane talked about earlier about the new certifying exam, any of those resources. They're going to be able to access those, and you can access those by clicking that Get Certified section. Next slide. To log into your new My ABEM portal, you'll see on the top right-hand corner of your screen is the login button, and that will take you to the new My ABEM portal. You should have received an email about 2 weeks ago to activate your new portal account. If you didn't receive that, I would encourage you to give us a call or shoot us an email after this webinar so we can make sure that we get your account activated for you. But this is going to take the place of where you used to go to do any of the activities for ABEM for your program. Next slide. Once you log in, you'll see that you have kind of like two options on the side, kind of similar to what you used to have in the old portal. The first thing that's going to display on screen for you is going to be the My Certification menu. That's going to show the things about your personal continuing certification requirements. Next slide. The lower section is the Manage Program section, and that is where you will do any of the activities related to verifying your residence training, registering for the in-training exam. So if you see there on the screen, there's options to do these things in a couple of different ways. We'll start with the in-training exam. You can click on the in-training examination on the left-hand side of the screen in that Manage Programs menu. Once you do that, you can click the View Details to see more information and get that registration started. Options on the screen are to be able to see who is and is not registered, see if you have any payments that are pending. You can easily just select all of your residents or just those that are intending to take the exam. get that registration going. That will be once the in-training exam registration opens a little later this year. You'll see all of this information. Next slide. More immediately, you'll need to verify your residents have successfully completed their training. There are two ways to access the verification. One way is what is shown on screen by clicking that verify training from the main screen. There's also the option for training verification on the left hand under the menu on the far left side of the screen. But either way is going to get you to the same spot. And that is a list of your residents who still have their training unverified. And then there's also a list of the ones that you have completed the verifications for. For the residents that you're going to be verifying training for this year, you'll click that verify button and it will take you to that residence verification form. You'll see near the top of the screen on that form, kind of what you're used to seeing from in the past, that ABEM is going to ask you to attest that the physician completed all of the required training and the required amount of time in your training program. And then the rest of the screen is going to go through the questions that are on the new verification form. Again, as Diane explained, this year is kind of to get you ready. And next year, those questions are going to be the only questions that you will see for verifying that a resident has completed their training and is ABEM board eligible. Next slide. And once the training is verified, then you'll be able to click the verify button from that main screen again, and you will see that the resident's training is verified. You can click the view details button to see the confirmation. So clicking that will bring up the form that says that you've verified that this resident has successfully completed their EM training with your program. Next slide. With that, I think we're going to go through some questions. I know that we have had questions coming in the Q&A. There were some that were sent beforehand. So we can go ahead and get started with some of those questions. We did get a question, and I think I can handle this one. Someone wanted to know about proving a resident's board eligibility and if they could print a letter. Right now, the best way for them for any of your new grads to verify their ABEM status and get something for their new employer would be to send us an email. They can email us at verify@abem.org, or they can give us a call, or really if they were just to email any of the ABEM email addresses that are available through the ABEM website, somebody would be able to help them. Let's see what other questions we have. There was a question about if there will be more information on scoring, including rubrics. Diane?
It's a good question. I think that if you haven't looked at the discussion of the sample videos and collated that to the PDF that directly says a successful candidate will be able to ... and there are usually 5 or 6 items that follow that a successful candidate will be able to. Those map directly to the scoring rubrics. So that is the holy grail when we're talking about scoring rubrics. So please look at those documents, and that's what ABEM is going to be sharing when it comes to a rubric.
We have a question for you, Diane, about the attestation form. Someone mentioned that they would like to know more about what the not competent designation means, and some of the kind of to expand on some of the information that you gave at Cord.
Yeah, thank you for that question. I can speak to this, and that this is the last year. The residents graduating in 2025, this is not viewed as a high stakes or a summative evaluation. Starting in 2026, you are absolutely correct. If you cannot check off all 14 of those competencies, including that the resident is able to practice emergency medicine successfully independently, then those residents should not be leaving your training program. Do we have an option to extend the resident or to open it back up or for next steps? That is really on the training program itself to offer those opportunities for residents. So I think a best practice in this is to be discussing the program director attestation form with the residents each and every year and tracking their progress towards meeting all of those competencies. This shouldn't come as a surprise to the resident in the last month of their terminal year of residency. But instead, it's a benchmark or a signpost throughout residency that either a resident is progressing and going to be able to complete on time, or they're going to need to stay in residency longer.
Thanks, Diane. We have a question in regards to the certifying exam, the videos that have been released, and that those videos don't demonstrate that the candidates have to perform a physical exam. Should residents, as they are, and new grads, as they're preparing for the certifying exam, what should they be preparing for in terms of giving a physical exam during the certifying exam?
Yeah, that's a great question. So keep in mind, these are standardized patients. I cannot have a standardized patient replicate wheezing for you, unfortunately. I can't have a standardized patient replicate a pulsatile abdominal mass for you, for example. So a history is what the candidate will be taking when they come into the room. And then there'll be a slight break in the case where they say, I'd like to perform a physical exam, and the standardized patient will be handing the candidate a listing of physical exam findings, including pertinent negatives, but also any positives in the physical exam. Again, I'd really encourage you to take a look at the patient-centered communication video that is out there, because that is, I think, demonstrated quite smoothly in that video. And I would suggest that when you're mocking up cases to prepare your residents for the certifying exam, that this is exactly what they do. They don't perform any physical exams, but instead a piece of paper is handed to them that has all the physical findings on it. Thanks for that question.
We received a question about verifying training for PGY3s. Somebody wanted to know when they'll be able to do that. And we usually don't have those verifications available until July 1st. If somebody has an early grad, somebody off cycle, that's going to be done sooner or is done already, and you do not have a verification form for that resident already showing up in your portal, then please shoot us an email or give us a call so that we can make sure that that residence form is populated and you're able to verify that person's training.
Julie, can I lean in and
yes.
answer a couple of questions about at the exam?
Yeah.
Somebody put in a question about, will there be a timer in the room for candidates to reference how long they have to complete their the cases? There will not be a timer in the room. The cases are of two lengths, the 15-minute cases, which there are examiners in the room So they will be doing time management for the candidate. The cases that have standardized patients in the room, we are mocking up 2 different scenarios for that now. We may have a 2-minute kind of warning that happens 8 minutes into a 10-minute case. That will give the candidate a fair warning that it's probably time to start wrapping up the case. But we're going to see how that plays out as we do a few practice administrations this year, and what the candidates feel is best, and also really what the examiners feel is best in those situations. What's the schedule of the day, and how many breaks will there be? So there are 5-minute breaks between each of the cases. That is just enough time to kind of move on to the next case. There is a longer 20 to 30-minute break between the 2 components of the certifying exam. So between the clinical care cases and the procedure and communication cases, there's a 20 to 30-minute break. So you'll do 80 to 90 minutes of testing, have a 20 to 30-minute break, another 80 to 90 minutes of testing, and that completes the exam for the day. Do they need to wear a white coat? Nope, they sure don't. Professional attire or scrubs is just fine. And will ABEM coordinate an affiliation with the hotel to get room blocks with discounts for candidates? Absolutely. We'd like to do everything that we can to help alleviate the cost of the attendance for this exam, and that is certainly something that we're looking at. Are the candidates going to be assigned to a testing date like the current oral boards? Yes. They will be assigned to a specific date, and they will also be assigned to a specific session within that date, either the morning session or the afternoon session. Is it reasonable to advise residents to request a time off ahead of time for the certification exam to ensure employers can plan for the resident to be off?
I
They
can
will.
answer that if
Please go
that's all
ahead.
right.
Yeah.
We are going to allow candidates to state their preferences. There's no guarantee. And so maybe taking time off, it's kind of their call. So there's no guarantee, but we will let them pick between which session would be preferable for second choice, things like that. And we will do our best to be able to accommodate as many of the residents or the candidates as possible to give them what they need and what they want.
Great. There's another question about the prioritization cases, and the resources highlight the use of skills including task switching and managing interruptions. To what degree will interruptions during the prioritization case be utilized, and in what forms? Yes, there will be interruptions. There will be a few interruptions per case, including interpretation of critical lab data that comes back, or EKGs, or nursing questions, or other distractions. So I would count on there being at least a small handful of those during any given case. A new question just popped up about the hotel. Will you be providing a shuttle, or you're expecting candidates to have or to rent a car? Julie, do you want to handle that one?
The hotel and the testing center are within walking distance of each other. As far as the logistics of going back and forth, it will be a walk, short one. If a candidate needs some sort of special accommodations, there'll be the opportunity to let us know that in advance so that we can make sure that that they're able to get back and forth between the 2 locations.
Julie, there's another one. Have they announced when the My MCert login will be back up?
We are in progress of working on that. We want to make sure that everything works the way that you are expecting, and that all the modules and all the content are available the way that they should be, so that there's no hiccups when people are trying to complete their requirements. Hopefully, it will be in the very, very near future. I can say that, luckily, we are not against a deadline where anybody has a requirement that's due, this week. In addition, we know that there are some modules that were set to expire, and we are working on plans to be able to make sure that everything is available so that the downtime does not disadvantage anybody in terms of availability of modules.
There was another question in prioritization about, can we dive into an example scenario of a setup for a prioritization case focused on an MCI? Specifically, will the candidate need to know how to set up incident command, mobilize resources, discharge of non-emergent patients, triaging patients according to green, yellow, red, black categories, etc. I think some of those are absolutely fair game. We are not expecting candidates to be able to set up incident commands, but mobilizing resources, discharging of non-emergent patients, triaging patients according to green, yellow, red, black. I think that all of those are exceptional assessment points. And we will be talking with the prioritization case managers. I think that it's a fair suggestion that we put up an MCI example. It's just a matter of bandwidth and whether we can get that done within the next couple of months for it to be really impactful for those preparing for the exam. But thank you for that suggestion, and I will take it forward.
Diane, it looks like there is a question about the procedures that candidates can potentially be tested on and what they might expect. Expect that EM graduates to be competent in all procedures required. How could we expect them to be competent in those that are not required as part of ACGME EM requirements?
Well, it's a good question, and clearly the ACGME is using the procedures that it uses to test the adequacy of the environment. That does not mean that those are the only procedures that are necessary for a successful emergency physician to complete. There are a number of other procedures that we do on a daily, weekly, monthly basis that are still critical. Now, I would like to emphasize the point that the definition of competency is competency in a practicing emergency physician. So if you have, if you've used a modified ANGOF to find 27 critical steps of a procedure, none of us can complete 27 critical steps of a procedure in the exact order that's specified every single time that we do a procedure. That is not the level of quote unquote competency that we're looking for. We are looking for a level of both knowledge of the procedure, knowledge of indications, contraindications, being able to manage complications of the procedure, and some of the critical kinesthetic or kind of eye-hand coordination aspects of the procedure that an average competent emergency physician would be able to complete. That is the focus of the procedural competency, not to make sure that an exhaustive checklist of minutiae in a procedure is completed exactly the same way every single time, but rather that it's the measure of competence in completing any of those procedures. I hope that helps.
And it looks like we are at the hour. So in order to be respectful of everyone's time, I do want to thank you, Dr. Gorgas, for all of the information, and thank all of our participants for being here with us and for their great questions. If there was something that someone needed that was not answered, please feel free to call the ABEM office or send us an email, and we will be glad to get you whatever information we can.
Thank you very much. Thanks for your time, everybody.